KNSS News Time now, 8:11. It's Wednesday. That means it's time for Wednesdays with Wagle. Dr. Jason Wagle with Kansas Perio and Dental Implants. Good morning, Dr. Wagle.
Good morning, Steve.
Let's talk about gum disease, Dr. Wagle. What are the risk factors for gum disease?
Gum disease, it's also called periodontal disease, can affect anyone, but certain people are going to be at higher risk. Some people are genetically predisposed to gum disease. For example, in the overall population, men have a 20% higher rate of gum disease than women. And in pregnant women, gum disease is associated with higher rates of preterm, low birth weight babies.
Okay. What about age?
That can also be a factor. Older people, both men and women, have a higher incidence of gum disease. In fact, 70% of all people over the age of 65 have some form of gum disease.
Okay, now I'm taking it personal. Are there any other risk factors, doctor?
Actually, there are quite a few. For example, certain medications such as contraceptives, antidepressants, and certain heart medicines, to name just a few, can be factors. That's why it's best to advise your dentist and periodontist of your full medical history.
And what about smoking?
As you might expect, Steve, smoking and tobacco use of any kind can increase a person's risk or chances of developing periodontal disease.
Any other habits that can lead to more gum disease?
Clenching and grinding of your teeth are also going to be risk factors. Regular dental examinations are going to be important for this because your dentist can often help correct these problems that affect your gums, teeth, and bite.
And any other behavioral issues?
Well, stress is definitely a factor. We've discussed that in the past. When you're under stress, your body has a harder time fighting various diseases, including gum disease.
And does diet play a role?
Yes, that's very important as well. Poor nutrition and obesity have been shown to also be risk factors for gum disease.
With all those risk factors, how can gum disease be controlled?
You know, Steve, the key is early diagnosis and treatment. See your dentist twice a year and have an annual periodontal evaluation. The good news is that even with all of these risk factors, periodontal disease is preventable and treatable, especially in the early stages. At Kansas Perio, we emphasize prevention and education, and we routinely treat gum disease and save teeth when possible.
All right. Thanks for your time this morning. Wednesdays with Wagle, sponsored by Kansas Perio and Dental Implants. When it's time to get serious about your smile, go to kansasperio.com. You can give them a call at 685-2731. Wednesdays with Wagle. Dr. Jason Wagle this morning.